of importance for oculoplasty surgeons. We'll be studying this for the sake of only one question. The main band of Lockwood's ligament inserts laterally on which structure? Whitnall's tubercle, frontoethmoidal suture, lateral cheek ligament of the orbit, or lateral canthal tendon? To know the answer, we must study the fascial septa of the orbit. Fascial septa of the orbit are orderly and continuous. And this is a very important word. It's a continuous connective tissue septa, histologically formed of smooth muscles, of cartilage, elastin, and collagen. They are formed of tendons fascia, extraocular muscle capsule, periorbital membranes or periosteum, and the condensations of the cheek ligaments, Whitnall ligament and Lockwood ligament, which are both different from the muscle cheek ligaments, by the way. So the whole story starts by tendons fascia. Tendons fascia is a combination of collagen elastin surrounding the eyeball. I can just draw it here. So it's just surrounding the eyeball. And because there are muscles, let's say this is a superior rectus, for example, so tendons fascia splits and forms the muscle capsule. And this happens around each muscle. Then, what's called the cheek ligaments of the muscles arise from the muscle and adhere this to the bony orbit. So it attaches to the periosteum of the orbit. It goes to the front and goes to the back. In the back, it attaches to annulus of Zinn and attaches to the fascia around the optic nerve. Tendon's capsule posteriorly can't be dissected neatly from the orbital fat. So the fibers intermingle with the orbital fat. Toward the globe, it has fine trabeculae attached to the globe. And this is evident on dissection for subtenon anesthesia, for example. Anteriorly, it forms the condensations, Whitnall ligament and Lockwood ligaments. So, cheek ligaments are condensations of the fascial orbital connective tissue. They are organized in a way to support the globe. So the globe does not show significant downward movement after inferior orbitotomy, for example. The globe is still hanging, carried by hammock. Lockwood ligament is a hammock ligament. It's just, this is a globe, and these are the orbital walls. This is Lockwood ligament. Entrapment of this ligament, for example, might cause restricted eye movement, for example. The lateral orbital wall has the frontoethmoidal suture, and 11 millimeter downwards there is an elevation which is the most prominent part on the surface of the lateral orbital rim. This gives attachment to the cheek ligament of the lateral rectus muscle and the suspensory ligament of the eyeball, which is Lockwood, and aponeurosis for the levator palpebrae superioris and the lateral palpebral ligament. The frontoethmoidal suture is important because it gives attachment to Whitnall tubercle. It's attached medially to the superior oblique trochlea and laterally, and then it divides the lacrimal gland into palpebral and orbital loops running in the middle, and then attaches to the frontoethmoidal suture. So Whitnall's ligament does not attach to Whitnall tubercle. And this is misleading here. So how come? There is Whitnall's tubercle. Whitnall ligament must attach to it. No, this is wrong. So Whitnall's ligament attaches to the frontoethmoidal suture, not to Whitnall's tubercle. Please go back to the recordings and check this question on Whitnall's ligament. So what I would say here is the main band of Lockwood's ligament, it can come in other words. It says the arcuate extension of Lockwood ligament inserts laterally on Whitnall's tubercle, frontoethmoidal suture, lateral cheek ligament of the orbit. It joins the lateral cheek ligament but doesn't insert into it. Lateral canthal tendon, again, this inserts to the bone and attached to the other surrounding structures like the periosteum, like the lateral cheek ligament of the orbit. The correct answer is the correct answer is Whitnall's tubercle. So Whitnall's ligament inserts into the frontoethmoidal suture and Lockwood's ligament inserts into Whitnall's tubercle. Just to mention the rest of the story of fascia bulbi, tendons,